Hello, welcome to Simulation Center. This video is going to cover how to use intermittent catheters with our simulators and what that looks like in the simulation room in case you've never been in here before. So with our simulators, they will be on when you're practicing skills with them. We will not be speaking for the simulator because we're going to be running 3 or 4 different rooms, a couple of us. So you will just pretend, act like you're talking to the simulator, come into the room. For skills, they don't necessarily have an ID band on, so just simulate, pretend they have the ID band on, check their ID band, and then talk to them like you would a real patient, maybe a nonverbal patient, where you're just talking to them and explaining to them what you're going to do. So they will not respond in skills, but in simulation, theoretically, they will respond to you if you're doing a simulation. So our simulators, when they're on, they are breathing. You can hear breath sounds, you can hear bowel sounds, you can hear lung sounds. They have pulses, so if you need to feel the pulses for whatever reason, you can do that too. And the rest of it, I'm just going to tell you how it works with intermittent catheters. So you got that. In the range, you have gloves, should you need gloves. We have a sink with running water and soap, a towel dispenser over here to the side. If you need a towel dispenser, you can do that. Room should have hand sanitizer in it. You can use that as well for your simulation or skills lab. For intermittent catheters, I'm just going to run through how that looks as far as just from a simulation, skills lab, or my part of it. I'm not going to go through how you actually put that in or how it looks to do the sterile technique or anything. I'm just going to show you how the simulator or how the intermittent catheters respond with the simulator. So if you need sterile gloves, we do have gloves in our intermittent packs here, but also in this upper cabinet in Vivian's room, we have some sterile gloves. We have small, size 8, size 9, and extra large. If you are using these sterile gloves, and this is what we package into our catheters, Foley catheters and intermittent catheters, you want to size up. These are sterile, natural surgical gloves, and they're powdered free. These are from Pocket Nurse, so they're not going to fit like they do in the hospital or healthcare situation. So if you use our sterile gloves, size up. So if you open up a pack and it's the wrong size of gloves, just come over here, get the size of gloves you need, but do size up. If you get into the room and you go to the urinary door, and each of our cabinets and drawers are labeled for you to glance at to know what's in there, pull your intermittent catheter. But if you get to this drawer and you do not see it, then go over to where the bed linens are next to the wall, open these doors up, and sometimes towards the back you should have additional intermittent supply. When you are inserting a device into our simulators, because they're made of silicone, you need a lubrication to use with them. We don't use KY jelly because it congeals on their skin and doesn't really help with making the silicone of the intermittent catheters slide against the silicone of the simulator. So, for the purpose of simulator usage, we have mineral oil that goes with our simulators. This is what will take the place of KY jelly. You will not have KY jelly in your packs. You'll notice when you look at them, they're not truly packed to come brand new. We open these up and we take out the harsh stuff or the stuff that can't be used with our simulators, and we repackage them. When you open it up, I'm just going to take that out there. And like I said, there will be sterile gloves. If you can use the size that's in here, use it. If not, you can already have your other sterile gloves ready to go. It comes with a waterproof tray, some iodine prep, which the iodine prep is not actually wet. We have taken the iodine and dried out the sticks because iodine will stain the simulator. It will stain the silicone. So with the iodine stick, you can take it out and you can actually rub this on the simulator, and it's not going to harm our simulator at all. So go through whatever steps you need to do your sterile tape, or to clean the simulator, your patient. There's a fenestrated drape in here, the little cup that simulates your sterile cup that you might collect urine in. And then in this pack is also some simulator lubricant, the mineral oil. If it's not in the pack, this is against the wall over there. But most of the packs should have it in, especially if you're doing the intermittent catheter by yourself. We would want it to be like it is in a lot of situations. So that's why this is packaged in there. That's your sterile lubricant, or whatever. And then you also have your intermittent catheter. So when you pull your intermittent catheter, you want to make sure this is lubed up good, because it's going to make your life a lot easier if you have the lubricant against it. This has got about a cc in it. You use about half of it. It should be about all you will need. But if you feel like you need more, use more. Now with the simulator, it does have the urinary pathway. So you will prep your simulator over which way, and then it does glide up in there once you find the right hole, and it will go all the way in the simulator. And if you need to spray some lubrication on the simulator too to make the insertion easier, you can do that as well. But it should go all the way in there. And if the simulator's prepped, she can have urinary output. So just make sure your pan's up and under her. And then when you're finished, just pull it out. Gather up all the supplies you've used. The catheter trays, you can dispose of them under the sink. Just open the drawer and dispose of it. And then the spray, just make sure it goes back over here for the next student that will come in to do their intermittent catheter insertion. So that should be all the advice hopefully that you will need to complete your simulation, or to complete your skills lab in the simulation center. If you do have any questions when you get to simulation, just let me know, and we'll be glad to cover that with you. Okay, thank you.